Hong Kong has announced plans to conduct a universal voluntary coronavirus testing scheme that could cover millions of residents. Chief Executive Carrie Lam says with the support of the central government, the free scheme will start in 2 weeks. The city is undergoing a third wave of COVID-19, averaging more than 100 daily cases for the past 2 weeks. Roland Lim has more.
Now, Mrs. Carrie Lam says her administration is now ready, with the help of the central government, to conduct citywide testing. Hong Kong health officials reckon there could be up to 1,500 silent carriers of the virus in Hong Kong. Since mid-July, authorities have tested some 130,000 people from high-risk groups like minibus and taxi drivers, those who work in the markets, elderly care homes and restaurants. Now, only 1 out of 2,500 actually tested positive. To prevent large crowds and queues, the universal testing will involve separate distribution and collection points of test kits so that people can take their own throat swabs at home.
We actually have not worked out all the details that you want to have, but because of the spreading and circulating rumors, I consider it necessary to come out and dispel any misunderstanding in the first instance. Otherwise, people will be misled by those rumors circulating on the social media. If people still have concerns, they don't need to come forward. Okay, this is an entirely voluntary program to provide testing for those who want to have a test, either to find out whether they are infected or they just want to be more sure that they are safe.
Mrs. Lam dismissed privacy concerns, saying that testing staff won't know the identities of those who provided the samples. Their identities would actually be represented by a barcode only. Remember, a team of medical experts from mainland China and 3 mainland-linked labs, that's BGI, King Med, as well as Hong Kong Molecular, have set up temporary labs here in Hong Kong to raise the city's testing capabilities. As to the effectiveness of universal testing without a lockdown of its residents, well, health officials acknowledge that the effectiveness may be undermined, but ruled out mandating that people stay indoors for 14 days, recognizing that pandemic fatigue has already set in.